Hello everyone, I'm Dr. Rose Khavari. In my more than 15 years of working with older adults in urology and functional health, I've noticed something very specific. When my patients come to see me, we can openly discuss blood pressure, diabetes, back pain, or trouble sleeping. But there's one topic that is almost always met with a profound silence, a hesitation. Just last week, a gentleman in his 70s, a very sharp former engineer, sat in my office and stared out the window for a long moment before saying, "Dr. Rose, my wife and I, we haven't been intimate for over a year now. I just thought it was a normal part of getting older, but I can tell she's sad. And to be honest, so am I. I miss her." His words truly touched my heart, and they are the reason I wanted to make this video today. Because his story is not unique, it's the story of millions. Today we are going to talk about a subject that few people mention, but everyone should understand: sexual health and intimacy, as we enter the golden years of our lives. We're going to discuss it in a way that is scientific, respectful, and full of hope. And that gentleman's story reminds me of another one from a lovely patient I'll call Carol, who was 68 at the time. She came to me initially for bladder health, but I could sense something else was weighing on her. One day, she confessed with tears in her eyes, "My husband and I used to be so close. Now, it feels like there's a wall between us in the bedroom. I know my body has changed after menopause. Things can be uncomfortable. I started to make excuses to avoid being close because I was embarrassed and I didn't want to feel any discomfort." She continued, "The worst part was I thought he had stopped finding me attractive. He became quiet and distant, and I assumed it was because of me. The silence in our home was deafening." For months, they lived like respectful roommates, each trapped in their own private prison of misunderstanding. The breakthrough came one evening, not in the bedroom, but in the kitchen. He was helping her with the dishes, and he gently took her hand and said, "I miss." In that moment, the wall crumbled. She realized his distance wasn't rejection, it was his own form of care and fear. They talked for hours that night for the first time in years about their fears, their changes, and their shared desire to simply feel close again. Their story is a powerful reminder that often the biggest distance between two people is silence. And it's why understanding what's truly happening in our bodies is the first step to bridging that distance. So let's talk about those changes honestly and without fear. Understanding the what and why takes away the mystery and replaces it with knowledge. And knowledge is power. For the ladies, after menopause, estrogen levels drop significantly. This can lead to a condition that in medicine we call vulvovaginal atrophy, but I prefer to explain it simply. The tissues in the vaginal and vulvar area can become thinner, drier, and less elastic. This can cause dryness, itching, and discomfort, or even pain during intimacy. It's one of the most common and treatable reasons women like Carol avoid intimacy, yet so few feel comfortable talking about it. In addition, your level of desire or libido may change. This is often hormonal, but is also deeply tied to energy levels and emotional well-being. It is completely normal, and it does not mean you no longer love your partner. For the gentleman, the most common change involves erectile function. As we get older, the blood vessels throughout our bodies, including in the penis, can become less flexible and narrower. This is the same process that can affect our heart health. Lifestyles and conditions that affect the heart, like high blood pressure, diabetes, or high cholesterol, also affect erectile health. Testosterone levels also gradually decline over time. This combination can make it more difficult to get and maintain an erection. I want to be very clear, this is not a failure of masculinity. It is a physiological change, a medical signpost often related to your overall cardiovascular health. And for all of us, our energy levels might not be what they once were. Our bodies may need more time and more direct stimulation to become aroused and reach orgasm. Chronic conditions like diabetes, heart disease, or arthritis, and the medications we take for them, can also impact our sex lives. These physical changes often bring about powerful emotional ones. And this leads us to what is often the biggest hurdle of all, the one in our minds: If our bodies are the hardware, our minds are the software. And often it's the software that needs the most significant update. Let's talk about the psychological barriers that are just as real as any physical change. Letting go of your younger self. It's natural to remember how you looked or felt at 30 or 40, but comparing your 70-year-old body to your 30-year-old body is like comparing a wise old oak tree to a young sapling. Both are beautiful, but they are in different seasons of life. The goal is not to reclaim the past, but to fully inhabit and celebrate the present. Your body has carried you through decades of life, through joy and hardship. It has earned your respect and kindness, not your criticism. The practice of self-compassion. So how do we practice this? It's simple but not always easy. It means talking to yourself the way you would talk to a dear friend who is struggling. When you look in the mirror and see a new wrinkle or a scar, instead of sighing, try thinking, "This body has lived. This body is my home." When you feel a physical limitation instead of frustration, try a gentle acknowledgement. "Okay, this is different now. How can I work with this lovingly?" This shift from self-criticism to self-compassion is transformative, shifting focus from performance to presence. So much anxiety comes from the idea that intimacy is a performance with a pass-fail grade. This is perhaps the most damaging myth of all. I urge you and your partner to make a conscious shift from performance to presence. This means letting go of any goal or expectation. The only goal is to be present in the moment with the person you love. Focus on the sensations you're feeling right now, the warmth of their skin, the sound of their breathing, the feeling of their hand in yours. When you remove the pressure to perform, you create space for genuine connection and pleasure to arise naturally in whatever form it takes. Once we begin to quiet the critical voice in our heads, we can start taking practical steps to nurture intimacy. Think of this as your detailed map. First, the most important step: communicating from the heart. As we saw with Carol and her husband, all change begins with a conversation. Choose a quiet, relaxed moment. Start with I statements. Try saying, "Honey, I miss feeling close to you. I miss our hugs. I feel like we've been a bit distant lately, and I'd love to find a way for us to reconnect." Or, "I know both of our bodies are changing, and sometimes I feel a little self-conscious or anxious about it. I was wondering if you ever feel that way too. I'd love to talk about it together." When your partner shares, just listen. Listen with an open heart without judgment. This conversation itself is an act of profound intimacy. Second, redefining intimacy, rediscovering the joy of connection. Free your minds from the narrow idea that intimacy only means one thing. It's a whole garden of experiences. Non-demanding touch-hold hands while you watch TV. Give a hug from behind while your partner is washing dishes. A shoulder rub after a long day. These touches send a constant message: "I'm here, I care." Sensual intimacy. Listen to an old favorite song together. Cook a delicious meal and savor it side by side. Share a slow dance in the living room. Emotional intimacy. Ask each other deeper questions. What was the best part of your week? Is anything worrying you right now? Connecting on a soul level is the strongest foundation for physical closeness. Third, caring for the machine, golden habits for your body. Our body is a magnificent machine. It needs good fuel and regular maintenance. Smart exercise. A brisk daily walk is one of the best things you can do for your circulatory system. Yoga or stretching helps with flexibility and reduces stress, which is a major barrier to desire. Specifically, Kegel exercises. These are the unsung heroes. You do them by tightening the same muscles you would use to stop the flow of urine. Hold for 5 seconds, then relax. Repeat this 10 to 15 times a few times a day. For ladies, it can increase sensation and support the bladder. For gentlemen, it can improve control over erections and ejaculation. Nutrition for vitality. A heart-healthy diet is a sex-healthy diet. Focus on flavonoid-rich foods. Think berries, citrus fruits, apples, and even a small amount of dark chocolate. These help keep blood vessels flexible and healthy. Healthy fats, avocados. Nuts, seeds, and olive oil are crucial for producing hormones and reducing inflammation. lean protein, and plenty of water for energy, muscle health, and overall function. Sleep is the foundation. A lack of sleep increases the stress hormone cortisol and can lower testosterone. It drains your energy and your desire. Prioritize getting deep restorative sleep. Fourth, when to see a doctor and how to start the conversation. Sometimes lifestyle changes aren't enough on their own, and that is perfectly okay. Seeing a doctor is a proactive, powerful step. See a doctor if you are experiencing pain during intimacy. Erectile dysfunction is happening frequently and causing you or your partner distress. You notice a severe drop in desire that is affecting your quality of life. You suspect a medication you're taking is causing side effects. Prepare for your visit. Write down your questions. You can use these scripts. Doctor, I'd like to discuss something a bit personal. I've noticed some changes in my sexual health, and I'd like to understand them better. I'm taking these medications. I'm wondering if they could be affecting intimacy between my partner and me. I have been experiencing some discomfort during intimacy. Could you advise me on solutions like lubricants or other treatments? Please remember, as doctors, we have these conversations every single day. To us, this is medicine. This is health. We are here to help you, not to judge you. So what is the main message I want to leave you with today? First, sexual health and intimacy are a vital part of a healthy and happy life at every age. It is your right to enjoy connection. Second, the changes your body and mind go through are normal. The biggest hurdles are often silence and self-criticism. Understanding and self-compassion are your most powerful tools. And third, and most importantly, you are not alone. Let's break the silence. Talk to your partner. Talk to your doctor. Connection in all its beautiful forms is a precious gift you have every right to enjoy during your golden years. Thank you so much for taking the time to listen to this very personal but very human topic. I hope our conversation today has given you light hope and the confidence to take better care of yourself and your relationship. Getting older isn't the end, it's a new chapter full of potential. Let's live this chapter to the fullest. If you found this video helpful, please click the like button and subscribe to my channel so we can continue having these important conversations. And please share it with a friend or a loved one who you think might need to hear this. I wish all of you great health, joy, and a life filled with loving connection. Goodbye, and I'll see you next time.